Today's video topic is symptoms of ankle arthritis and treatment options. Ankle arthritis is a condition where the cartilage in the ankle joint wears down over time, leading to pain, stiffness, and reduced mobility. In this video, we will explore the symptoms of ankle arthritis and the treatment options available. 1. What are the symptoms of ankle arthritis? The symptoms of ankle arthritis can vary from person to person, but common symptoms include pain in the ankle joint. This can be a dull ache or sharp pain and may be worse with activity or weight bearing. Stiffness in the ankle joint. This can make it difficult to move the ankle and can worsen over time. Swelling around the ankle joint. This can be caused by inflammation in the joint. Reduced range of motion. This can be caused by the stiffness and swelling in the joint. Crunching or popping sounds in the ankle joint. This can be caused by the bones rubbing against each other due to the loss of cartilage. 2. What are the causes of ankle arthritis? Ankle arthritis can be caused by a variety of factors, including age. As we age, the cartilage in our joints can naturally wear down over time. Injury. A previous ankle injury, such as a fracture or sprain, can increase the risk of developing ankle arthritis. Genetics. Some people may be more genetically predisposed to developing ankle arthritis. Rheumatoid arthritis. This is an autoimmune condition that can cause inflammation in the joints, including the ankle joint. 3. What are the treatment options for ankle arthritis? The treatment options for ankle arthritis depend on the severity of the condition and the individual's symptoms. Some options include medications, over-the-counter pain relievers such as acetaminophen or non-steroidal anti-inflammatory drugs, NSAIDs, can help to reduce pain and inflammation. Prescription medications such as corticosteroids or disease-modifying anti-rheumatic drugs, DMARDs, may be prescribed for more severe cases. Physical therapy. Stretching and strengthening exercises can help to improve range of motion and reduce pain in the ankle joint. Assistive devices. Using a cane or brace can help to support the ankle joint and reduce pain. Surgery. In some cases, surgery may be necessary to repair or replace damaged cartilage in the ankle joint. 4. Can ankle arthritis be prevented? While it may not be possible to completely prevent ankle arthritis, there are steps you can take to reduce your risk. Maintain a healthy weight. Excess weight can put extra stress on the joints, including the ankle joint. Wear appropriate footwear. Choose shoes that provide adequate support and cushioning for the feet and ankles. Avoid high-impact activities. Activities that involve jumping or running can put extra stress on the ankles and increase the risk of injury. 5. Conclusion. Ankle arthritis is a common condition that can cause pain, stiffness, and reduced mobility. Treatment options include medications, physical therapy, assistive devices, and surgery. While it may not be possible to completely prevent ankle arthritis, maintaining a healthy weight, wearing appropriate footwear, and avoiding high-impact activities can help to reduce the risk. If you are experiencing symptoms of ankle arthritis, it is important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.